What's up guys, Dr. Aaron McNally here with Revival Performance Physical Therapy, and today I'm going to be showing you guys a hip mobilization exercise with a band. So with a power band, you can get pretty much the thickest power band that you can get. These pull-up assistance bands, you can get these pretty cheap at any sporting goods store. You're going to step in through there and put that way up there in your groin. So make sure everything's in the right compartment there, pulling that right up there in the front of the hip there. And then with that, you're gonna kneel down, so you can use some padding if you need to, but if you don't have that, that's fine. It just might be not as comfortable on your hip. And so what this is doing, it's pulling mostly lateral, meaning to the side, but just slightly posterior. So it's pulling laterally and posteriorly. So just barely behind me, but mostly to the side. And I want that pulling really much as you can tolerate. It's not gonna really be too much. I mean, you could, but before it gets too much, you'd fall over. So getting that position just where it's really pulling like that, and then get a good stable position like this. And what you're gonna do is just gently push that hip out as it's distracting that hip joint, and then drive it in. So you're just driving that hip out and in, and then kind of going in different positions just like that. So as it's pulling that joint, you're just rotating that knee out and in to really stretch the hip joint out, and kind of going over the toes in different positions like this, just to get that hip really loosened up, okay? Another one you can do for this to get that hip flexor is it's gonna be more of a posterior glide here. So that hip is getting pulled backwards. And in this position, I'm just kind of tucking my tail, shifting forward as this is trying to pull my hip backward in the socket there. So it's not going to get as much anterior impingement if you're getting any anterior impingement from those hip flexors being tight and pulling it forward. So it's as close as I can get up there in the groin, so it's real close to the hip joint, which is deep in there. And then I'm just going into the hip flexion just like this. Common problem with this is people will arch their back like that. Not that that's that big a deal, but you could be thinking that you're getting a lot from the hip, but you're actually just getting from the back. So get a little bit of a posterior pelvic tilt, a little tuck in the tail, and then shift forward so you don't feel any of that in your back. It's all just focused there in the hip. So do the prescribed amount, have fun.